participants at a two-day workshop on protests to policy have canvassed the appropriate use of protests as a formidable tool to achieving citizens' demands for a better society. The workshop, organized by the International Republican Institute, aims at translating protests to policies of government for the good of all. TVC News senior correspondent Joke Adisa has details.
The citizens' right to protest is enshrined in the constitution of every country across the globe. In Nigeria, Section 40 of the Constitution guarantees the rights of the people to register their displeasure against government's programs and actions. Over the years, protests have been citizens' last resort at getting government's attention. A number of notable global incidents come to mind. They include the Bangladesh quota reform movement and the NSAS protests in Nigeria. The International Republican Institute is implementing a global protest to policy project in Nigeria. Its aim is to distill issues that precipitate protests in societies for onward conversion into policy and projects.
At this moment in Nigeria, with institutions and democracy yet to be consolidated, protest is more important than ever. But how protests are conducted and how the government responds determines whether the demands of the public can be translated into policy change.
In an overview of the Protest to Policy project, the Institute lists factors that make protests a success and the challenges.
You have to diversify nonviolent tactics and find a way how you can sit across the table with the government to bring about policy change. And then there are other techniques such as how do you minimize hierarchy, how do you get all these partners of the society involved.
Participants are upbeat about the prospect of achieving government policies using the instrumentality of protests.
If we look at the Nigerian context, especially in the last 10 years, when we see some of the protests that has happened from the demand side, the Not Too Young to Run, for instance, the Bring Back Our Girls movement, the market women kind of policies, we've seen how the demand side keep placing demand on the supply side.
It's really about citizens' engagement with their governments and in an active manner as active citizens.
Among topics for discussion at the two-day event are the state and the protest, communications and media engagements, as well as political economy of protest and advocacy. Joke Adisa, TVC News, Abuja.
And talking health now, the late detection of oral cancer remains a major concern for experts at a one-day oral cancer training in Abuja. They are seeking the use of artificial intelligence to help promote the early detection of oral cancers in order to help reduce the cancer burden in the country. Health correspondent Kemi Balogun has details.
In recent times, artificial intelligence has proven to be a game changer in several fields of science and medicine as professionals continue to use technology to find more ways of saving lives and promoting the health and well-being of the human race. This issue forms the crux of this meeting as these experts seek ways of using AI technology to promote early detection of oral cancers. They are certain that the use of higher technology can improve the accuracy of early detection by more than 90%, preventing cancers as much as 10 years earlier.
What we advocate is that even persistent gum infection should be reduced to the BRS minimum because they increase the risk of oxygen species that has the likelihood of damaging the DNA. And some of the most important risk factors are what we know, tobacco and alcohol. The most important thing about this is that they alter the way the human body is able to handle what we call reactive oxygen species.
It makes it easier for practitioners to be able to keep a better eye on such people and thereby picking oral cancer at its infancy when it's just developing. And as it has been said severally, early detection means that we'll be able to cure cancer in a particular victim.
More than 1,000 cases of oral cancer and 700 deaths are recorded in Nigeria each year. These experts are using the theme, the use of artificial intelligence in early detection of oral cancer and oral pre-malignant disorders to find solutions towards reducing the oral cancer burden in the country.
We are training our community health workers because if you go to communities, there are no oral health workers there. Everybody wants to come to the town. There are no dentists in the communities. They all come to the town, Abuja, Lagos, but in our rural communities where these things are prevalent, we don't have.
The Federal Ministry of Health says it will launch a new oral health policy document for better preventive measures against oral cancer through community trainings later in the year. Kemi Balogun, TVC News, Abuja.
Delta State Governor Ifeanyi Okowa says rather than move to restrain the movement of medical professionals abroad, the federal government should seek ways to make the nation a hub to train more doctors, nurses for export to countries who have short supplies. Governor Okowa stated this during the inauguration of the collegiate system in the Delta State Schools of Nursing held at the College of Nursing Agbor. Ikenna Amici has details.
This unveiling of the College of Nursing Agbor indicates the upgrade of the institution, but the process of achieving this status was thorough, with plans to meet up requirements with Governor Ifeanyi Okowa through the Department of Nursing Services over the years has been working on. At this ceremony to commence the inauguration of the 3 schools of nursing, Secretary General of the Nursing Council underscores the immense contribution of Governor Okowa in achieving this feat.
Your Excellency, let me also use this medium to thank you most sincerely for your giant commitment, not only in the health sector, in their state well-being. One can look at numerous developments that have been recorded under your leadership. Most especially on the health, a lot of transformational improvement has been made in the health sector.
The governor, who is excited at the upgrade of the health institution in the state, expressed concern over the exodus of medical practitioners in the country. He proffers a solution which is at variance with the proposed bill mandating 5-year compulsory practice for medical doctors.
I'm not one of those that will basically come out to say we're trying to come up with laws to restrict the movement of people out. And what we need to do is to ensure that there's a planned program by the government of Nigeria to truly train more than our daily need, more than our yearly need, and ensure that we're able to enter into strategic alliances and partnership with countries to be able to export some of these our trained children out. And I believe that the collegiate system that you started is going to encourage this.
The students of the institution are delighted at this latest development, which will definitely affect the qualifications they will obtain.
Seeing the HND and the other specialty included in one certificate is a very big privilege that I really love so much.
For us, it means that we are equal to the university students because it will be upgraded to HND, and with that we have equal opportunities with those that have gone ahead of us and all of that.
Delta State has schools of nursing in Eku, Warri, and Agbor. Ikenna Amici, TVC News, Agbor, Delta State.
To other stories now, the Grand Cadi of the Kwara State Sharia Court of Appeal, Justice Abdul Latif Kamaldeen, is asking Muslims to sustain their level of piety even after the holy month of Ramadan. This is just as another Cadi, Justice Abdurrahim Ahmad Sai, says modernity or civilization cannot be divorced from the teachings of the Holy Quran. Correspondent Ibrahim Alege has details.
The last 10 days of the holy month of Ramadan usually witness increased supplications to Allah, with some Muslims staying in the mosque throughout the period. This Ramadan lecture by Masalam Islamic Foundation was established by the pioneer chairman of the Independent Corrupt Practices and Other Related Offences Commission, ICPC, the late Justice Mustafa Akambi. it couldn't have come at a better time.
The whole essence is to remind ourselves of what exactly is our duty on the heart. For instance, like one of the ayahs of the Quran, وَمَا حَلَوْتُ لِلْجِنِّ وَالْإِنسِ إِلَّا لِيَعْبُدُونِ. They have created man not for anything but to worship me.
In his lecture, the Grand Qadi of the Kwara State Sharia Court of Appeal, Justice Abdul Latif Kamaldeen, advises Muslims not to drop the guard of piety even after the Ramadan fast.
To be conscious of Almighty Allah, to be pious, and to try to exhibit all the good things that Allah subhanahu wa ta'ala commanded out in the Quran to do. And I advise the Ummah to follow and the good legacy left by our father, Honorable Justice Mustafa Kamil.
At another lecture, a Qadi of the Kwara State Sharia Court of Appeal, Justice Abdul Rahim Hamad Sai, says religion cannot be attributed to any form of backwardness, but rather is a true agent of civilization if properly practiced.
Religion cannot be responsible or attributed to any form of backwardness or whatever. So, and we can as well attribute most of the contemporary crisis that humanity is falling into to the deliberate attempt by man to turn their back to the divine teachings as enshrined in the holy books. I speak particularly to the glorious Quran, which is especially my domain.
His line of thought was also shared by the acting vice-chancellor of the Kwara State University, Malete, Professor Lukman Jima.
Whatever you need in terms of saying modernization or modernity, it's right there in the Quran. But just because people, they don't actually understand, okay, the intent of the Quran, that's why they feel that they should look elsewhere.
And to believe that anything modernization is nothing but supposed to be tailored toward the value of Islam. What Allah Subhanahu wa Ta'ala precisely give to us as a way of life.
The lecture was organized by the Ilorin Emirate Community, Kwara State University, Malete. Ibrahim Alige, TVC News, Ilorin.